Good evening, everyone. A very warm welcome to all our esteemed panelists and audience members joining us today for this important discussion organized by Voice of Healthcare and supported by CreaMed. The topic for today's session is Challenges in Insulin Delivery, Diabetes Educator's Perspective on Insulin Syringes and Pen Needles is both a timely and crucial. Diabetes management has advanced significantly over the years, but the role of effective insulin delivery remains a cornerstone of optimal patient outcome. Yet, we continue to face significant challenges, from patient acceptance of insulin therapy to ensuring precise and safe administration. And today, to discuss this and to have a brief a discussion on this, we are joined by an exceptional panel of experts from diverse fields of healthcare who will share their insights, experiences, and practical solutions to overcome these challenges. Let me take a moment to introduce them. Ms. Samrin Khan, Certified Diabetes Educator, Senior Dietitian at Nurture Health Solutions, Mumbai. Welcome to our show, Ms. Samrin.
Thank you, Simran.
Thank you. Dr. Koulsoum Houssein, MBBS MD, General Medicine at Holy Family Hospital, Mumbai. Welcome to our show, ma'am.
Hi. Hi, everybody.
Thank you for joining, ma'am. Ms. Pooja Singh, Assistant Nursing Superintendent at Sarvodaya Healthcare. Welcome to our show, Ms. Pooja.
Thank you. Good evening, everyone. Thank you, Simran, for introducing.
Thank you so much for joining. Ms. Jeena Jose, Nursing Superintendent at Holy Family Hospital, Mumbai. Welcome to our show, ma'am.
Thank you. Hello, everyone. Thank you, Simran.
Thank you for joining, ma'am. Dr. Mohammed Ziauddin, Senior Consultant at Clinical Pharmacologist and HOD of Clinical Pharmacology, Apollo Hospital, Hyderabad. Welcome to our show, sir.
Thank you for everyone, and good evening.
Thank you so much, sir, for joining. And now we'll be starting with the panel discussion with my first question to Dr. Koulsoum. Ma'am, as a general practitioner, what do you think are the biggest barriers that prevent patients from accepting insulin therapy? And, and how do you address them?
So, in type 2 diabetes, which is usually where we usually start tablets initially. So, when the patients are on requiring insulin, it's a little late in their course of diabetes. So, they're not used to having insulin. So, one of the major barriers is patients are very resistant to insulin initially. They keep on telling you that you give me whatever medications you want, but no injections, because they feel it's habituating. Once on injections, they'll have to go lifelong on injections. So you have to explain to them patiently the course of diabetes. The second concern is the cost and how to educate them how, how to preserve the insulin, especially in the low cost population, because many of them don't have a fridge to preserve the insulin. Many of them don't have the means to buy the insulin. So that's a second barrier. And the third barrier is how to educate them, how to take the insulin, and especially how to monitor for hypoglycemias, etc. So how to prevent hypoglycemias and how to maintain minimum aseptic precautions and how to discard the insulin needles and syringes. Those are the main barriers in giving insulin to patients.
Thank you so much, ma'am. And one more thing. So, how do you help patients understand the difference between various insulin delivery devices like syringes and pen needles, and what role do needle length and gauge play in, making that decision?
So, usually gauge and needle and thickness is not a major concern. Most of the time, most of the patients require just 4 to 8 millimeter length. That's the usual length that we advise. And the thickness is the thinnest needle, that is the 31 gauge needles, are the ones we usually advise, so that they don't get any side effects or any injuries or any prevention of making it IM injection instead of subcut injection.
Thank you so much, ma'am, for explaining
So
that to us and to all our.
these are
Yeah.
standard sizes that we advise.
Thank you, ma'am, for explaining that to us and to all our audience. Moving on to my next question, Miss Samrin. So, Miss Samrin, in your experience, what are some of the most effective way to help patients understand and manage dosing, especially when they switch between different insulin concentrations like U100 and U40? And are there specific visual aids or tools you find most helpful to make them understand about this?
Thank you, Simran, for the question. So, in my experience, the most effective strategies and tool to understand and manage the manage the dosing is like, so we start the patient from the basics. So we explain the insulin concentration, like by explaining the insulin concentration to them. So whenever the patient comes to us, we educate the patient using simple terms, like explaining them about IU, like in 100 IU insulin, we tell them like 100 IU insulin contains 100 units per ml of insulin in it. If it's 100, like if it is 40 IU insulin, which means it contains 40 units per insulin to it. And also we highlight the syringe compatibility. So we stress the importance of matching the correct syringe with the correct insulin type. So, for example, like your 100 IU insulin, which comes with which like your 100 IU insulin should be given with 100 IU syringe only, and your 40 IU syringe should be given with your 40 IU syringe insulin only. So we also tell them regarding this, so that it helps in preventing the dose mistakes. And regarding the visual aids, so we at Nurture Health Solution, we make sure that we use visual aids such as like visual charts by in which we shows the different dose volume. For example, 100 IU or 40 IU. So we tell them. So we show them in the visual aids in a chart board that see, so if you are giving 100, if you are giving through 100 IU syringe, it means that it has 0 0.1 ml it has 0.1 ml, and if you are giving 10 units by 40 IU, it means that you are giving 0.25 ml. And also we explain them regarding the color code on the syringes. So which means like the 100 IU syringe should has orange cap, like it has an orange cap, so it should and the 40 IU syringe has red cap. So we explain them the significance of this, and it should not be like if you're taking that it should not be like you're taking 100 IU syringe with 40 IU pen. So we need to make sure that the syringe and the vial are taken properly. And also we give them the mock demonstration on the insulin syringes by telling them how to draw insulin and inject and also we tell them about the proper injecting techniques. And apart from this, we also make sure that we share some videos with them of insulin techniques with them, because when they come to the OPD, we teach them and they are aware of what needs to be done. But once they go home, it becomes really like sometimes they might have missed 1 or 2 points. So we also share the videos with them of like how to take insulin and how to do proper and the proper techniques which needs to be followed. So and the videos are available in their regional language like English, Hindi, Marathi, Gujarati, so that it becomes more easy for them to like understand and make sure that they implement it. And we tell them ki whenever you are giving them the insulin dose now, just for 1 or 2 days, make sure that you see the video prior to it, so that they are follow that they come to know that yeah, we are following the proper steps in that. And also once a session is done, we also we tell them to demonstrate what they have learned from the session, so that we know that whatever they have learned, like whatever they're telling us, they have taken the right message from us. And also regular follow-ups with the patient really helps us to know that they are following the techniques as what is being taught to them. And also and when they come during the follow-up, we check their lipos to see that the proper insulin administration was given.
Thank you so much, Ms. Samreen, for explaining us that question in a very elaborative manner so that every patient out there know what are the process normally, healthcare people follow when they are guiding them towards insulin and what are the do's and don'ts for that. And yes, it is very important to educate them at an early, stage and how do they take it uh, because they're not aware of that much and they're not used to it once they're starting for the very first time. So that can also lead to a problem. But thank you so much for explaining us to that. My next question is to Ms. Jeena Jose. Ma'am, as a nursing leader, what challenges have you noticed when it comes to training patients or caregiver or on accurate insulin dosing? And how do you ensure that both healthcare providers and patients maintain clarity in understanding the dosages?
Thank you for the question. As my doctor said, Dr. Koulsoum, when the patient get diagnosed as diabetic, they are really in a state of shock. Fear and anxiety comes in because you give them ample amount of tablets, but they don't want to take syringes. A fear of syringe, fear of taking needles, because it is not one or two dose which they are taking. It's like lifelong. Sometimes they have to take injections. So they say that there's a normal, they are stigmatized. Social stigma is there. People come and say, people used to say ki ek bar insulin, once you take insulin, then you have to lifelong dependent on insulin. So there is a resistance from their side. So you have to train them. So that again comes in, how do you explain them, the language barrier, because as the staff attrition is there, number of numerous staffs are going abroad and new people are coming, so educating them is a big challenge. So we have so many programs we have to develop where you need to train our existing staff, or we need to have educators where these patients should be trained off. So the language barrier between the patient as well as the healthcare provider who is training, that is because you may have educators present in every hospital, but the first line, the staff has to give education in the first line, because they are there with the patient and the relative throughout. They are the ones who are supposed to give hands-on skill to the patient. So next point is, when the patient is put on insulin and getting discharged, the complexity of insulin therapy. There may be patient who may be on with on a regular and there with the fixed mixed doses, where they have to plan their meals or their regimen according to, or we have to plan the insulin based on their activities and their meal pattern. So that is somewhere it is lagging behind. So that area needs to be covered up, where we understand the patient's activity level, the lifestyle pattern, and then deciding the insulin, because insulin therapy also, it is individualized. It is not based, every patient will be given the same dose. Then, as I said, every need is varying from patient to patient, so health education strategies also differ from person to person. Even though sometimes you have n number of educational strategies for education, sometimes at the end when you evaluate patient relative, or the patient says they haven't understood, maybe it is not because your educational strategies is not effective. Maybe there is a gap between patient understanding and your teaching. So one has to cover that first, and that has to be done by a skillful person. Every person, or the nurse or the educator in the first line, may not be able to understand that. That's one problem which I face. Then follow up, because these patients, once goes out of from your like IPD and OPD, will come back either with some other illness or with a complication. There's a lack of follow up. So they have
Yes.
to be consistent, so that we understand what is their level of understanding in the second or third visit. Then of course there are certain psychological factors, as I said, stigma factors, fear, which affect their adherence to insulin therapy. Then comes like most of the time when the patients are there with us in IPD sector, inpatient setting, these patients, if they are cognitively okay, they understand it, but it is sometimes difficult for them to self practice it and give to themselves. So it is a mutual training of both relative as well as the patient. So some cases where where the relatives are not there, their patients may be with their caretakers, and caretakers may not be there throughout. The caretakers may change. So again, there is a gap of transmission of information from one caretaker to another. The patient comes with a complication, and sometimes as the patients are technophobic, whatever however you try to train them, they are least adherent to the technology or the pen usage. Again, they commit error. So that's it.
You pointed out very right points, ma'am. It is of the first line people out there to help them out. Like you said, you need to educate the patients on that, and once they get to know about it that their diabetes, there's this anxiety, that stigma around them, that this, how do they handle it, how can they lead a normal life with this, and all such things. And yes, the constant education and follow-ups are very necessary. Like you mentioned, if not this, then they'll come up with some other problem. So all those things are very necessary, which the healthcare providers are very well taking care of it. So my next question is to Miss Pooja. Pooja, when guiding patients to choose the right insulin device, what factors do you consider most important for patients' adherence and comfort? So, how do you handle patient inquiries about the needle size, comfort, and ease of handling it?
Thank you, Simran, for the question. The story starts when the person checks the blood sugar first time and they come to know that the sugar level is very high. And by keeping on checking one time, then second time, then third time, they start having in their mind that okay, something is wrong, and then they go for HbA1c, that is glycosylated hemoglobin checkup. And then they get to know that oh, it's being high and they are diabetic, and it's a big psychological trauma for them because they are not able to accept that really they are hyperglycemic. And be an healthcare worker, whether it is educator, admin, dietitian, anyone, first we should be empathetic toward the patient who is actually diagnosed with the diabetes mellitus. And by educating them, we need to be empathetic, and we ourselves also should be sensitized enough to understand their level of thinking. What might they be thinking about the diabetes, what kind of queries they might be having inside them. So first is like we need to motivate them. So this is the foremost and important thing. We need to motivate them that it is not a difficult task, they can easily take care of themselves if they are having high blood sugar level, and they can take the accountability of taking the treatment, whether it is OHA like oral hypoglycemic agents or insulin. So first we need to make them comfortable that it is okay and they can easily taken care by themselves. First and foremost, this is the important thing. Second one, when we are teaching about, as Ms. Jeena also said, that it is very important to provide the education and as per their language preferences, whatever the language they're having, we should have multilingual handouts for them to educate, whether it is video demonstration or hands-on demonstration. So accordingly, this is also a part by teaching them the types of devices they can use. Theoretically, if we say we have four types of devices, like we have insulin syringes with needles, we have insulin pens, which are having temporary cartridges, then permanent cartridges, then we have insulin pumps, and then insulin jets. So, if point wise, I would like to say there are total four types of devices. But the important thing is how we can prescribe what the proper device is suitable for a particular patient. So there are some key areas, there are key factors which we need to identify as a healthcare worker so that we can educate the patient properly and they can be adhered with the proper insulin regimen. So, first and foremost is lifestyle of the person. Whether the lifestyle is active lifestyle or the lifestyle is sedentary lifestyle. Active lifestyle, we can say like a farmer who is actually doing hard work and sweating a lot, and the sugar is actually utilizing more in the body. Or in modernized way, we can say an athlete. So they are having the part of active lifestyle. Sedentary lifestyle, like not so much of active involvement in physical work. So, as per these two, for the active lifestyle, what we can prefer is we can prefer insulin pump so that they can easily take on, as they don't have time to take again and load the syringe, take the needle out, loading the medicine and put on. So, the pen will be preferable for them. If we talk about the sedentary lifestyle, the people who are having like office work, daily routine work, they can have this option. Like they can use syringe, they can use pens, they can use pumps, anything they can use. But for the active lifestyle people like athletes, we can promote insulin pens, and we need to motivate them also, because if we talk about the active people, they are actually getting scared that they will have difficulty in following the treatment regimen of insulin therapy. So the part is we need to motivate them. As I have just one example of Mr. Gary Hall, he was the Olympic gold medalist. He was a swimmer. So he was actually diagnosed with the diabetes mellitus, and he actually took the accountability and followed the proper regimen of the insulin, and then he won the battle. So this is first part as for the lifestyle and routine activities. Second, if we say the patient, how the vision of the patient is, like suppose if we have old age patient, they might be having problem in handling the small and delicate syringes and needles, pens. They might find difficulty in that. Plus, because of the visual impairment in old age, they might be feeling difficult to see the actually label of the syringe, because it is written in very small letters, 1 unit, 2 unit, 3 unit, like that. So it will be difficult for them to follow and understand, and there can be the chances that the dose can be underdose or overdose. So in that case, where the visual impairment chances are there are some insulin pens which can be used, like having the more capital letter and big letters labeling in those pens. Like some companies like Innovo, Inolet, Indico, these are some examples of insulin pen having big labels, so that the patient who are not able to see the labels, they can use this. Then we have jets. So we have insulin jets. This is actually for the people who are having the needle phobia. So those who don't want to get pricked again and again, there are some insulin jets also for giving the insulin dosage. It was actually invented in 1980. So what is happening in this? The With the high pressure and with the high speed, the medicine is going inside transcutaneously inside the skin without any pain and any needle prick. So in that case, when the patient are having needle phobia, these insulin jets can be used. If we talk about the ease to use, so of course the insulin pen are more easy to use, because syringes, they are preferably, we need to see the loading dose also, then we need to check it. Everything is taking time as compared to the insulin pen and insulin jets. So this is more. But if we talk about the cost and finance, then we can go for insulin syringes and needles. So these are some important factors which we need to look after while prescribing the type of insulin devices to our patients. And for the strategies, how we can teach them, if we are teaching them to inject the insulin, we need to guide them by demonstration and taking return demonstration of the same. So what we can do is we can provide them empty insulin pen, empty insulin jet, any syringe, so that they can practice how to load the medication, that is insulin, and how they can give it, how to pinch the skin so that the needle goes only subcutaneously, not intramuscularly, because we need to make them understand that if the injection get intramuscularly, it will take lot of time to absorb as compared to subcutaneous. So just guiding them, showing them, demonstrating them how to pinch the skin, how to take a needle, how to pinch it, and then how to rotate the site of injections. Because lipidodystrophy is a very commonest example. While in OPD visits, when the patient is coming for the follow up, we are looking that some area is very dense and they are having complaint that taking proper insulin also, they are not able to get their normal blood sugar level. So we need to make them understand that taking again and again on the same site, it makes tissue dense and it makes difficult for the insulin to get absorbed inside the body. So we need to guide them how to rotate the sites of injection and how to wait for the time. Like if they are putting the injection in the skin, they need to wait at least for 3 to 5 seconds so that the injection get absorbed inside the body and then they can leave the skin which they had already pinched. So these are some techniques which we need to
Thank
guide them and we should keep in mind. Thank you.
Thank you so much, Pooja, about explaining us all the factors which is most important for patients for adherence to their comfort, and also their inquiries how the needle size and comfort about handling at ease. Because all these are very important point which needs to be kept in mind while prescribing them the insulin, their lifestyle, the food habits, and every other thing. Moving on to my next question, Dr. Zia. So, from a pharmacology standpoint, what are some common safety concerns you observe with insulin administration, particularly with the use of syringes and pen needles? And how can these concerns be minimized through patient education and device selection?
Yeah, yeah. Thank you for the question. So the common safety concerns while patients are being used insulin syringes or pens while insulin administration. So when we talk about insulin administration, 5 points come into my mind, which are very important, which are can be labeled as a safety concerns, specific safety concerns while insulin administration. That is, one is the needle reuse, and second could be improper dosage selection. And as the previous speaker mentioned about the not changing the sites, so third concern could be a not changing the sites while administering the repetitive dose, and an improper injection technique. And the fifth one is disposal, improper disposal of needles, sharps. These are the important safety concerns which comes to mind when we talk about insulin administration in the patient. So, what is this needle reuse? What we need to do? What is the strategy we can put forward so that the needle reuse can be educated to a patient why they should not do? So, needle reuse is significantly it will increase the risk of infection due to maybe the contamination from the previous administration or previous injection that can happen. So we need to educate the patient here and emphasize the importance why they should never reuse or and dispose them properly in sharp container, and also they should not share the devices with any family member while using, and they should be educated clearly, it says, about the problems what can happen if they use the same needle, and which can also if they use it without the needle also there are chances infections can happen there also. Then incorrect dosage selections, like many the previous speakers also mentioned about selecting the correct near syringe for the correct vial of the insulin, like 100 IU vial need to be having the 100 IU syringe, 40 IU concentration vial having the 40 IU syringe. So there should not be any substitutes of these syringes when, especially when the patient visiting a retail pharmacy next to the community pharmacy, and they ask for a specific unit syringe, and the pharmacist try to substitute because of non-availability or some other reason. So that should not happen. They should be very educated that this is my particular syringe which I need to buy from the pharmacy, and that I need to store it, and that only should be used. There is no substitution which should be happening for the syringe selection. And improper dosage selection also it comes into play whenever there are nowadays we have pens, and if the pen is not clear enough, if the pen device is not clear with the bold letters of the measurement of the doses, So that also can lead to improper dosage selection while the patients are going to use or dial the proper dosage with the help of the dialer in the insulin pen. So improper dosage selection is also one more safety concern which can be minimized by giving a very good insulin pen and educating the patient, which has a very clear visibility of the dial dosage to minimize the dosing errors, as well as educating the patients on syringes and also the using the color code for the syringes if they are not able to remember which units, which 100 or 40. So those kind of education techniques needs to be incorporated while at the pharmacy or the dispensing or by the nursing educator for minimizing the dosage error. The next is improper injection technique. As previous speakers also mentioned this point, and there is injecting at an incorrect angle, like too deep into the muscle also should not be injected, which can lead to a rapid release of insulin, and that can also affect can cause potentially hypoglycemia. So teaching the patient, educating the patient on administering, teaching them how to administer this insulin, and that technique is very important. The angle at which they need to inject and how much and which the lift they whether they need to lift the skin and how they have to administer that injection, and also to bring down the cold chain. If it is a cold chain, then bring down to the room temperature before administering that particular insulin dose into the body. So that is one. And not rotating the injection site, like a previous speaker also mentioned this, like repeatedly injecting on the same side, what will happen, it will cause a lipodystrophic condition, which is a simple terminology, it is like lumps which are formed under the skin. When these lumps are formed, hardened lumps are formed into the skin, so if the patient keep on injecting on the same side, the absorption of insulin comes down, the amount of insulin which is entering into the patient's bloodstream, which is available for action, that amount absorption will come down because of this repeated injection into the one side, which is causing lumps under the skin. So, what can happen? Consequence: the patient control of the blood sugar may go here and there, and then the prescriber end up prescribing more amounts or increasing amount of insulin dose rather than educating the patient to shift the site at each time they inject. So when we talk about the injection site, we need to educate the patient what kind of site he needs to inject, which are the first preferable site, second or third, and what kind of pattern he can follow while shifting the doses. And there can be easy cutouts which can be given to a patient so that he can mark which one was given at which site previous, and he can decide on the subsequent doses and keep on changing the injection site. The next important is the improper disposal of this sharp. Not using a sharp container for disposal can result into an accidental needle sticks. So these concerns need to be minimized by educating the patient that this we have to teach the patient that what is the importance of disposing the sharps. So educating the patient there into how to dispose properly into sharp container, and also if there is availability of devices which is having auto retractor in the needle, which will prevent after injection it will just auto retract and minimize the risk of needle sticks injury, that also can be used. And also having some insulin level indicators pens with visible insulin level indicator, which they can see across, and then overdosing also can be prevented. So these are main important safety concerns which I thought, and these are the few steps which can be taken by the patients in preventing or minimizing these safety concerns. Thank you.
Thank you so much, Dr. Zia, for elaboratively explaining us to the most important points, or I should say, the guide for patients making informed between the different types of needles, insulins, delivery devices, and every other important aspect for this. My next question is to Dr. Koulsoum. Ma'am, when helping patients choose between syringes and and pen needles, what factors are most important from a clinical standpoint? And how do you ensure they understand the differences? And also, how do you guide patients in making informed choices between different types of insulin delivery devices, keeping in mind their lifestyle and medical needs?
So Definitely, the lifestyle of the patient and also the uh, cost of living is important in this choice, and also how well they will understand how to take the injections. So, if the patient is very active, has to go to work every day, we prefer to give them a pen. It's easier to dose and inject. We don't have to uh, actually aspirate the injection, get a vial of insulin plus syringe together with us at work. We just need to carry the pen. And the pen can be carried without any ice if it is kept in a cool place, not in the sunlight. It can be preserved even outside the fridge. So, and it's easier to just dial and inject. So, for an active person who has to go out to work, definitely we prefer to give them a pen. The second choice is for a person who's at home, who's not very affording, then we would explain how to inject themselves with a syringe and how to aspirate the insulin, etc. However, the hurdle is when you have to mix two types of insulin. Sometimes we need to mix rapid acting insulin along with a short acting insulin. In those cases, we either have to give two types of pens, rapid acting pen insulin, or along with the long acting insulin pen. Or to keep it cheaper, we can use the same syringe and in put in two mixed syringes, a rapid acting along with a long acting insulin. So in those cases, using a syringe would be easier. And but the other problem is discarding the syringe. If they have no means of discarding the syringes, it would be better to give them a pen again. It would be easier at the end after using the syringe. After using the pen, they can discard it in wherever in the hospital whenever they come for their next visit. However, the needles also have to be discarded, so that also we have to explain to them that they have to use a new needle even in the pens each time. So that's how we choose, depending on the kind of patient we have in front of us. We usually advise them whether to prefer a pen or prefer a syringe with a needle.
Thank you so much, ma'am, for explaining that to us. Moving on to my next question to Ms. Samrin. As a dietitian and diabetes educator, what are some of the initial challenges you encounter when working with newly diagnosed patients, particularly regarding insulin management? And what misconceptions do you frequently address when it comes to insulin therapy? And how do you guide patients to overcome those barriers?
The challenges which we face, like the initial challenges in insulin management. So first is the emotional barrier. So what happened is many patients, they feel very overwhelmed and or associate insulin with the personal failure on the severity of the condition, and they are like, why us, why we need to go on insulin, is there anything wrong which is going? And and also they have needle anxiety. For children with type 1 diabetes, like they do have a lot of needle anxiety, and like not only the child but even the parents are very anxious. I will, like what we have seen is like child is less anxious but the parents are more anxious, like they need to prick the child every time, so they become very anxious and overwhelmed, and they feel like it's very discomfort, and like and they had a lot of fear regarding the injections. So the emotional barrier is one of the major thing, and there is also a lot of knowledge gap. So many patients are unclear about how insulin helps to manage their blood sugar, which can lead to resistance in starting or adhering to the treatment. So then we need to educate them, like how it will help in improving their sugars, and by taking proper dose, how they can have a healthy lifestyle. Patient often find the basal bolus dosing a little overwhelming. So we tell them to say, like we simplify by their concept. Like we give them the clear explanation and we simplify their concept by the visual aids, or by giving them step by step guidance, and explain them how if you take proper dosing, how it will be helpful in improving their lifestyle. And in terms of diet, there is also a lot of lifestyle adjustment involved. So which like they have like patient usually worry about challenges in their meal timing, physical activity, or daily schedule. So we teach them how by following a healthy diet, making sure that taking the insulin on time, they can make it easier. And people also do have lot of myth on the diet, like they can't eat this, and they have lot of restriction list. So we also tell they have lot of barriers in terms of diet as well, because every now and then, like either on Instagram or YouTube, some or the other gyan they get, so you should avoid this and this will help in improving your blood sugar, and you need to take this water to improve your sugar. So even that are they do come up with a lot of challenge, many queries to us stating that this will this help, will can I take this. So even we need to clear help in clearing that out. And regarding the common misconception which usually seen about insulin is first is like what the patient usually says, that insulin cures diabetes. So we need to tell them, like, see, for in terms of in type 1 kids, so we tell them, see, type 1 diabetes cannot be cured, but taking insulin help to manage it. And in type 1, like we need to tell them that now the pancreas are not working, so insulin is one of the therapy which will help in act like as the pancreas. So and also we need to tell them the difference between the type 1 and type 2 diabetes, because people usually have misconception, like my dadi nani is having diabetes but they are taking medicine, so why not my child? So we need to educate them the difference between the type of diabetes, and also the importance of insulin in managing the diabetes. And also the second most common misconception what we usually get is like injections are really very painful, and it is very difficult to take. So now, thanks to the modern technologies, because of that, like with shorter needles and with pens, now the pricking is not that much painful. It is, but not that much painful how it used to be earlier. So we tell them, we give them the demonstration, and with the right technique, with the right steps, they can prevent this pain while injecting the insulin. And also many of the patients also have this misconception, I can stop insulin if my sugars improve. So then we need to tell them and emphasize that insulin therapy is often a long term. In terms of type 1, it is for it's a part of their lifestyle. But in type 2 diabetes, like with proper diet, with proper management, if they are able to control the sugars well with the insulin, then if the doctor thinks like the patient can do well with the oral medications, then they do switch it. So we need to sensitize the patient about the importance of insulin, and how like the difference between the type 1 and type 2, so that they are not having any misconceptions regarding it. And regarding in terms of overcoming the barriers, so first we need to make sure that we have empathy, and we give emotional support to the patients. We need to understand their point of view. We need to know like what challenges they are facing, and we need to get solution out of it, so that they understand that even we as a healthcare provider are understanding their concern, and we are giving them the solution for it. And we need to be an active listener, acknowledge their fears, and normalize their feelings if they are like very anxious. And we need to build their trust by sharing our success, sharing the success stories of other patients. So that gives them the empower that if I manage my sugars well, with proper dosing, with proper medications, even my sugars will be under it. So we need to share success stories with the patients, so that it helps in encouraging them. And also at one go we shouldn't be teaching them a lot, because it becomes too much for them, and then it like sometimes even delivering too much at one go, it like takes to the wrong way. So we need to focus one concept at a time. So suppose and we need to break down the things, so that the patient understand in a easier way. We need to use visual aids, diagrams, mocking sessions, so that it helps in improving the patient adherence, and the way they can understand and it will help in overcoming the barriers.
Thank you so much, Samrin, for explaining us all the misconceptions that you come across while dealing with patients, and how important it is to address each of it, because there's so many other things they are taking, they're coming across for the first time, and to clear all their doubts is very important, so that they have this clear idea and awareness about what is going on with them. How can they be, take care of this thing in a better way? Thank you so much. Moving on to my next question to Dr. Jeena. Ms. Jeena, ma'am, what do you think are the biggest barrier that prevent patients from accepting insulin therapy, and how do you address them? And also, what role do you believe patient education plays in overcoming fears and misconception about insulin injections? And how do you address the comfort and ease of use of aspects of devices when making recommendations to your patient?
Basically, the barrier is as well spoken from my other speakers. The barrier is understanding language, cognitive abilities which they have. So it's very difficult to make them understand at one stretch. It has to be a subsequent, sessions with them. And second thing is, they, as the fear and anxiety that I've already discussed, these the barriers and the challenges which I've discussed with you in the previous talk is like their cognitive disabilities, their language barriers, they're resistant to accept whether now they have to start with insulin therapy rather than taking a pill a day. A pill a day is better than taking insulins. Fear of anxiety of needles and all. So how do we, the strategies which we have taken to ensure to improve the dosing in patient is like we first and foremost is understand the patient by himself or herself, what exactly the patient is, the background of the patient, the nature of the job, as well said by Miss Pooja, that the background is very important. Whether the patient is an athlete or the patient is a farmer, their workload matters, because we only give insulin irrespective of considering what activity he is going to carry out in the day, what meal he or she is going to have. So that is very much important. So understand that first. Motivation is one of the important strategy where we have to motivate them. They have to come out of their close stigma that taking insulin is making them life miserable. That is not going to happen. We have to make them understand that insulin is just like an hormone which is there inside their body, so it has to be regulated, right? So as per the level of, now they have got up with one or the other type of disease, diabetes, so they have to just modulate that insulin level. Yes, it is going to be painful. Yes, the pricks, as we have newer modalities which is coming in, that education we also can give to them, like as spoken by Miss Pooja, jets are available. We can, which will make their life more easy than painful. Then when the patient is there with us, with like starting, what we do is we educate our nurses who are there in the bedside who are dealing with the patient. So that's a part of their competency development. We train them on specific on certain diseases in which diabetes is also a part of it. Why? Because majority of our population comes with either as diabetes sole diagnosis or comes with a comorbidity with other diseases. So we have to deal with it, and sometimes patient comes as a complicated case, like complication comes with a nephropathy, neuropathy. Then we come to know that the patient is diabetes, as Madam Koulsoum, Dr. Koulsoum has told, like they come in an advanced stage. So whenever they come to us, we try that we start our education from that stage itself. So that comes as a primary level. We identify like what is the patient, what is a patient education about, how do they and what is their understanding level, and who are the caretaker along with the patient is. Then we plan, if suppose the patient is with insulin therapy, it is easy to administer tablets, but when it comes to insulin, we teach both of them, like patient as well as the relative. So hands-on experience is very important, as Ms. Pooja said. So what we do is, we, as the patient discharges plan, so we, before that, prior to 3 days back, if the freshly diagnosed diabetes patient is there, we start training both the patient, if the patient is in that conscious status, in a well conscious patient is there, as well as the relative, about the insulin therapy, like how to administer, when to administer, what is a meal, what time they have to take the meal as per their change of the insulin, what exercises, we little bit tell, part to part daily, we plan it in a way that slowly we train them, depending on what is the peak levels, when are they not supposed to exercise, beyond a range when the insulin at its peak, because it can lead to hypoglycemia. The major problem which we face is, patient is again have some fear of hypoglycemia, because we teach them, say we say that hypoglycemia is worse than hyperglycemia. It is true, but we have to, when we do training session, we have to understand them that we have to ensure the patient is not landing into a much anxiety, because when we say these are the complications, when you take something, the patient will refrain themselves of taking that. So the education has to be in a balanced way. You have to, of course, tell them about the complication, but systematically, step to step. Then we have to ensure that, like, we can also give pamphlets. We have pamphlets which is developed within our organization, which we can give them, so that if they have any confusion, because you are only training once or twice, so when they have any doubt, depending, like for example, for rotating the site, you need to see where are the sites, because even if we say we are professional, sometimes we tend to forget many things. So these patients are landing up into insulin therapy, giving injection for the first time, so they may forget what are the sites. So we have to provide them a visual uh, pamphlet or something like that, so that they see and they can rotate to prevent complication like that of lipodystrophy. And we need to always give somebody's point of contact should be there for them. If they have any confusions or queries, they can contact. And then, as I said, engagement of the caregivers is very, very important, because these patients, has to be reinforced, because it is not only the insulin which is there with them. We have to modify the lifestyle. As we say throughout the in the session, we were hearing about lifestyle modification, because lifestyle modification have an impact on the insulin requirement also. Second, the meal pattern. So the caretakers, if suppose an elderly is there, the caretaker has to be emphasized about the meal pattern. When they have to be very careful, the patient can land up into hyperglycemia. So all these factors has to be incorporated when you educate them. And of course, if they have an anxiety which is not being corrected by us as a healthcare providers, you can always have peer education. You may have so many other patients who are diabetic and really, complying to treatment and having a healthy life over the period of time. You can, make them talk to that person so that they are feeling motivated.
Thank you, Ms. Jeena, for explaining that to us. And all those points which you mentioned is very important regarding how we can address the comfort and ease of use of aspects of these devices. Thank you so much for that. As we are left with very less time, but we have so much to cover, I would request Dr. Pooja, Ms. Pooja, and Ms. Pooja to briefly explain us what feedback system have you found effective in ensuring nurses maintain high standards of patient education regarding this insulin delivery?
Yeah, thank you, Simran. So, the foremost and I think the best measure to maintain the best education standard is one-to-one talk with the patient. So, while taking rounds, like our admin team and all, we are taking rounds. We can just directly talk to the patient that whether they got the education regarding the diabetes or insulin therapy or diet management, was it useful for them, they found it effective or not, if they would like to add something, they would like to ask something. So one to one interaction will be the best way, face to face interaction is the best way to have the proper feedback from the patient. Then we can have some feedback form also we can develop, so it can be actually structured as per the need of our organization. So whatever the feedback we are getting from the patient, and if we, like for example, Ms. Jeena mentioned that we can have pamphlets. So suppose we have given them some pamphlets and they would like to know something more as mentioned in the pamphlet, we can just have a point and we can add up that point in the pamphlet. So feedbacks, whether it is positive feedback or negative feedback, we should take it as a count to improve our practices. And whatever the education materials have been provided by the nurses or by the diabetes educators or anyone, we can have the peer review also, that okay, you could have added this thing to the patient so that they can be benefited more. So peer review is also one of the thing which can actually improve the feedback system. And one more thing, now in today's modern technologies are there, so there are some logbooks which are actually some kind of apps we can find in our mobile and systems, like diabetes m is a mobile app which is actually a logbook which is keeping all the data of the patient, like how they have how much they have taken the insulin, what was the sugar level inside them, and then we can have the trend based study on that, and then we can improve on our feedback system. And after getting the feedback, we can have some huddle meetings with our team, and accordingly we can improve on that. We can have some quality improvement projects for the same, for the improvement, and that's how we can improve on the feedback. So feedback system plays a major role. Thank you.
Thank you. And you said it right. The education to educate and to have that correct feedback matters a lot while going forward and explaining and educating to all the coming up patients, as it is a very important part of the process. So thank you for explaining that. Moving on to my last question to Dr. Zia. Sir, how important is it to match the right insulin formulation with the appropriate delivery device, such as syringes or pen needles? And what role does this play in ensuring consistent insulin action and patient outcomes?
Yeah, very important question. We had been discussing this with the various speakers also. This regarding the various formulation of insulin. Insulin formulation is in the liquid form, which but the package is how it comes in a vial and in different pens, cartridges in form of the liquid that will be there. So how important? Yes, it is to match the formulation with the device. Yes, it is very important to match this particular formulation with the appropriate device. So how it plays a role in consistent insulin delivery and the patient outcome is there are types of insulin based on the how fast it act in the body. So like example, insulin, long acting insulin, which act for a longer time, short acting and rapid acting insulin, which acts quickly, and intermediate acting insulin, which stays for a longer time. So it is different types of insulin based on the action, mode of action, how it is going to act and sustain the blood sugar level in the human body. So short acting, rapid acting usually prescribed for 3 times in a day. So 3 times injections, and long acting is one dose, and it goes for covers for a longer period, 24 hours and above. Intermediate acting twice a day, and it is usually given twice a day and administered for a consistent level of the blood sugar. If there is a mismatch of these kind of types of insulin, and delivery, like a patient who have bought a pen but the cartridge is of another type of insulin, but the dosage is he is taking as per the schedule of the prescribed one, then there will be a mismatch and the doses can go here and there, and then patient may land up into overdosing or underdosing of this insulin. So that can happen. Another example which we already discussed multiple speakers regarding the vial and selecting the right syringe. So a syringe may be 40 IU or 100 IU, that we have already explained, and that selecting a right syringe, and no substitution. If in case it is not available, we cannot substitute or interchange that syringe concentration with another vial. So this is very important. The patient needs to be educated the formulation and the right device to be delivered, so that the consistent levels of insulin is maintained in the body as per the patient's required insulin prescribed insulin units. And if it is some mismatch, then the consequences will have the overdosing consequences like side effects. Hypoglycemia very important, that can happen. Sugars can go down, and then patient may land up into hypoglycemic symptoms starting from anxiety, sweating till it can go up to a fatal hypoglycemic coma. So, and then the consequences of underdosing, the underdosing consequences can land up to inappropriate treatment of diabetes that will further go on with the complication of diabetes, which we are all very much aware what complications diabetes can cause to our smaller blood vessels or the nerves end. So this is one. Thank you.
Thank you so much, Dr. Zia, for explaining us how much it is important to consider what amount and through which device the insulin should go based on the patient's lifestyle, diet, and everything. And thank you so much to all the speakers for coming to this platform with us, spreading the awareness on diabetes and educating our listeners out there in challenges in insulin delivery, because it is very important, like we all discussed and came to a point that because of the lifestyle, the diet, everything we are living around, how prevalent has diabetes become in everyone's life nowadays. 1 or 2% around us is a diabetic person. So it is very important to educate the diabetes patients as well as the caregivers, or otherwise the normal general public also, regarding their health. So, thank you so much for coming to the platform, sharing your insights and expertise with us, because it matters a lot. And at the end, we are thankful to Kriya Medical Technologies for supporting this very important discussion, to manufacturers to insulin pen needles in India, and are making great strides in improving the challenges facing insulin delivery in our country. So, thank you so much for coming here, and thanks a lot for spreading the awareness.
Thank you, Miss Simran. Thanks a
Thank
lot.
you.
Thank you so much.
Thank you.
Thank you
Simran,
so
voice of
much.
health.
Thank you.